With so many lives touched by addictions and mental health disorders, the Vital Signs conversation helps us to focus on how these challenges are addressed in our community and the potential pathways to wellness that lie ahead.
All of us in some way are affected by this. Our hope this evening is that with your input, we'll be able to generate ideas on really how to prevent these difficulties from happening in our community and to discuss ways that we can help those who are affected, who need a clear path to healing and well-being.
Be willing to share what you've gone through. We've had so many people come up to us after shows. We tell our stories. And I've never had anyone walk up and say, Rob, I got hit by a semi like you and I have a metal head just like you. No one has ever said that to me. But they just listen to our stories and they go, wow, this guy's been through something tough. So have I. He's talking about it. Maybe so should I. He got help. Maybe so should I. And we teach at every show that we do that if you've got something going on, I promise you this, you're not cursed, you're gifted. There's somebody out there that still needs your story. I love the fact that we're finally starting to talk about these issues, but we have just scratched the surface. Think about it. If 1 in 5 people had a heart condition, our government would try to make sure that there's somebody in every school that would know what to do if somebody's heart started to fail them, right? But no, we're cutting out the counselors. We're pulling away some of these most important resources that the kids need. Thousands of people will go through a tragedy today. They're not going to be better on the other side automatically, but if you make the choice, you can turn it around. You get help. You start talking about it, you can turn it around, but it takes some choices too, right?
We need to see the person through the diagnosis. You're not your thoughts. You're not the illness. That's not who you are. So I think connecting with your strengths and abilities and just your core values is critical to recovery and some of the value that you offer the world around you.
I think that is so crucial that young people know that asking for help is a sign of strength, that honoring that they need help is a sign of strength, and that, like you say, there's an element of choice, and in choosing to stay silent, they're hurting longer. And it's really interesting doing that work with youth because they want to talk, and when they find someone they feel safe with, sometimes it's very hard to get them to stop talking and refer them to the right resource within their school, and sometimes that's because that resource isn't there enough.
Getting 617 suicide notes, seeing the consistencies in those notes. You know, it's not about wanting a bigger house or a shinier car. It's about a sense of desiring a sense of significance or purpose and a sense of belonging.
One of the biggest, most influential factors is the impact of chronic stress. I think people who have been oppressed, people who have been abused, people who have been marginalized in any way are at higher risk for suffering from the effects of the chronic stress that has created in their environment. Focus on the relationships that the people have with their loved ones, with their friends, and how they spend their days, like their day-to-day routine. What does that look like? It sounds really basic, but it's super important, because if the people around you are not healthy, then there's a very, very high chances you're also not going to be healthy. And we know from all the randomized controlled trials and all the evidence-based medicine out there that people don't develop addictions if they're not stressed extremely in some way. So we as a society have to work hard to improve our stress levels.
It's 1 in 5 people that are affected by mental illness at some point in their life. If you drill down further on that, it gets even more alarming in that 1 out of 3 people, it's only a third of that demographic is actually getting the help that they need. And treatment, yes, let's always do the best that we can. If there's new practices, if there's new treatment methods, let's look at those things. But the fact of the matter is that treatment is what you do to or for a person. Recovery is a journey that you do with a person. It is possible for somebody to live a meaningful and purpose-filled life, either in the presence or the absence of symptoms. It's not a linear process. And really what we need to do is collaborate better as service providers. We need to look at it as a journey.
For some people, there is no prevention. And to say that we have to focus on prevention says that if you get ill with a mental illness, it's because you failed to prevent it somehow. And that is not everybody's neurochemical reality. Our emergency room visits in 2014, 30% of them were about mental illness. and 6% of the funding. So there's a discrepancy in how seriously we're taking that. One of the things that becomes really important when we're looking at prevention is that aspect of love and kindness. And we can't do that in a culture of competition. I go into classrooms where students have been told you can be anything that you want to be so long as you work hard enough and beat all 30 other people in your class. And so we have created a system where youth feel like they can't talk to each other. And we know that isolation is one of the key aspects that lets a mental illness or a mental health problem become a mental illness. And so it's about bringing community together.
So it is now your turn to have a say in all this.